Hey, 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 hey. Another 10 toes down segment. Let me get the people in the room. Hello. What's up, everybody? Hope you all had a good start to the week. It's Monday. How y'all doing out there? Hope you all are enjoying your February. Let me see. Get Dr. Lanier on the line.
What's up? Deal is
Hey, what's going on, Dr. Lanier?
with me.
Cool. Can you
I
hear me, see me, all the
can hear
things? Good. How you
you. Doing pretty
feeling
good.
today?
What you been up to?
I just got off of work. I was like,
Right.
pew, get back home.
I feel you. I feel you. Yeah. I get my camera right. There we go. Yeah, just busy, working, taking these kids everywhere.
Working,
Uh,
working. Yes. So you have how
Four
many children?
kids.
You got four.
Yeah.
Okay. What's your oldest?
12, and then youngest is 4.
Okay. You got a nice little spectrum.
It's tiring. Yeah, they all in everything, and taekwondo and dance, gymnastics, basketball, and everything.
All the things. Are you coaching any of those
I
sports
can't
for
do that.
them?
I can barely get them to them. I should though. My wife keeps
Indeed.
telling me I should like coach basketball or something, but man, it's so much. Like I say, just trying to get them back and forth
Yeah.
is enough. Talking about coaching and I don't know, but I should. Maybe next season. That'll be a goal.
Maybe next season. So you have what's the girls and
I
guys
got my
ratio?
oldest is a boy, and then I got 3 girls.
Oh, okay, okay. So you two are
We
tight
try to be.
then
Yeah,
in a world
yeah. Well,
full of women.
he almost he a preteen, and he kind of going through that. Staying up in his room and got to get on about his work.
Right.
Mess. So
Yeah.
tough.
Oh, more power to you. I pray for all the parents. I was at the grocery store yesterday and saw a woman with all 4 of her kids, and she had a little baby. I sent her a little prayer because it was a lot. They were running around. It was just like, oh, I was like, I'm gonna send her a prayer because that's all I can
Now
do.
you could have took one of the kids. You could have took one of them and been like, hold them for you while you do your grocery shopping. That's what you could. Nah.
That would have been nice.
what,
Okay.
what we talking about today? What we talking about today?
But today we are talking about cold feet and how weather conditions, specifically winter, affects our feet. Once again, my name is Sheena. I am owner and operator of Alpha Male Nail Care, and I've got my favorite podiatrist here, Dr. Lanier, Elevate Foot Doctor. You can find him on all platforms under Elevate Foot Doctor. And today we just want to go through some myths and talk and give people some truths about how winter affects people's feet. One thing just straight off the bat, like I see it in my numbers and I see it during, other nail salons as well, that most people think that you don't have to take care of your feet in winter months. I mean, most nail salons, we're jam packed spring, summer, but when the winter comes, you can see that attendance and appointments decrease. And I hear that a lot of times for guys when they come in during the summer. I'm like, when was the last time you had one? In the summer, usually last year around that time. And they'll usually be like, well, my feet are covered up, so why do I need to take care of my feet then? Or what, they think that they don't have to. So share with us why it's important all year long, but more importantly, what impact does winter weather
Yeah.
have
So
on feet?
first of all, in the winter, since the temperatures are lower, generally the moisture in the air is lower as well. And so if you don't have that moisture, then your feet are going to get drier a lot quicker. And so you want to make sure that you're looking at your feet, making sure they're not super dry. You don't want to go out ashy. You know, you don't want to go out ashy. And a lot of times what'll happen, and I think we're all guilty of it, your feet are going to be covered. You're not going to be wearing, open toes or anything like that. So
Right.
you don't bother to put lotion on, right? Get up in the morning. That's
Mhm.
one less step in the winter. It's like lotion, right?
Yes.
But not skip the lotion. You should
Mhm.
not skip moisturizer. You got to make sure, even if you don't think no one's going to be seeing your feet, they're going to be covered. Still want to make sure you're moisturizing every day. And right along with that, if you get your feet done during the summer, you should still get them done during the winter. Now, one thing I do tell my patients, especially my women, is that sometimes winter is a good time to maybe go without the nail polish because you do want to
Okay.
let your nails breathe sometimes and not have polish on them all year round. So
Is
you
that a thing?
you
Because
do.
I'm like,
Not,
you need to know polish. Okay, so polish does cause your nails not to breathe. Like I hear that
well, it's
all the
not
time, but I'm like,
necessarily not
is that a
breathing,
thing?
but it can stain the nails if you have them on there all the time.
All the
Don't
time.
misconstrue. I'm not
Okay.
saying don't go and get your nails done, but I'm saying maybe, get either a clear polish there or, get a
Okay.
manicure, pedicure, get all the dead skin off, but maybe skip the polish at the end is what I'm saying. Really just doing it, like I say,
Okay.
during the winter months. And then, especially talking to my female patients, I know in the summer when you are showing your toes more, yeah, go ahead and
Mhm.
get the polish on there because I know you want to be dead up, you want to be cute. So I
Yeah.
get it, believe me.
Mm-hmm.
But you just want to really make sure you're moisturizing and you want to make sure you're not having any cracks on your feet. Again, being a podiatrist, seeing people a lot, one of the main complaints people tell me is that, I have cracks on my heels. I can't seem to get the cracks off my heels. And again, more people are telling me that in the winter. And so a lot of times the first question I ask is, hey, what are you moisturizing with? And so you want to make sure that you have
Mm-hmm.
something that has urea in it. And
Okay.
urea, urea. And urea is going to be the substance in a lot of medicated lotions that's going to break down all that dry skin. It's going to help get to that really nice layer of skin and help preserve the moisture that's already naturally in your skin. So you're looking for urea. Most things are going to be like 40%, 45%. If you get higher, a lot of times those are going to be prescription that you want to do. But just don't,
Okay.
you gotta,
Okay. I was going to ask that. Is that an over the counter situation? But you say the higher percentage would be over the counter. Is that for like severe
yeah,
dry
it can be.
skin?
And so, a lot of times my patients come to me, and usually I tell them get Gold Bond foot cream, get
Okay.
Eucerin, CeraVe. They're going to have urea in it. And if that doesn't work, then we can do a prescription. But I'll tell you what most of the time it is. It's not that the medication doesn't work, is that we're not consistent with putting it on. And you have to make it a
Mm-hmm.
routine for you, not just in the winter, but you want to make sure you're doing it in the winter because your feet are going to be so kind of closed in socks and shoes. So you want to make sure you have that protocol, that process that you're doing all year round. Whether you take your shower at bedtime and then you're putting on everything else, and you have your foot cream that's right beside your bed. You're putting that on and then
Mm-hmm.
putting on a fresh pair of socks. That's what I find to be the best thing. That's what I do. That's what my wife does. We always have it on our nightstand. It's always right beside us, so
Yeah.
that we're making sure that we remember to do it. And again, doing it all year round. Not yeah.
All year round. Absolutely. So when it comes to urea, does that affect those that are that deal with like psoriasis and extreme like dry skin? Does that help them, or should they
So no, they
avoid
can
that?
take that as well, but it's going to
Okay.
help with decreasing their dry skin. But usually, you have something, like psoriasis. Obviously, you're going to need something else as well. Usually those
Right.
folks are getting some type of steroid treatment or something
Mm-hmm.
that's under the care of a
Mm-hmm.
dermatologist that's trying to decrease their skin from drying out and turning over so much. But urea can be part of the regimen that they're using as well.
Cool. So I did have a question about like when it comes to winter weather, does that do anything to your circulation? Does that affect, like does cold weather? I always hear like diabetics talk about their feet
Mm-hmm.
are always
Yeah,
cold.
so it can. So usually, when people have diabetes, or more commonly, if they have like peripheral arterial disease, they already have less blood flow to their feet. So bad circulation is what we
Hmm.
would say, right?
Okay.
That's,
Like
circulation
what?
bad.
Okay.
You know, fancy it
Uh-huh.
up, say peripheral arterial disease, when the blood flow is not going down to their feet. And that can cause a sense of coldness to their feet. So
Okay.
when their feet are already cold, and then you add on top of that, the weather's cold outside as well, then that can kind of be a double whammy. And patients find it very hard to keep their feet warm. And so that could be a telltale sign, if they always have cold feet, that they may have bad circulation. The other thing that it can be
Okay.
a telltale sign that we've kind of talked about in other IG lives is neuropathy. Again, getting with our diabetic patients, if they just have those weird sensations, my foot feels cold, feels a little tingly, just doesn't feel right. A lot of times that can be letting them know that they have some neuropathy going on.
Hmm. How would you well what would be a good massage technique? I am like reflexology focused when it comes to our massage portion of the pedicure. Are massages good to help improve the circulation and kind of help bring some warmth to the feet, or is a massage too harsh or too, can it be damaging to a
Well, I
person that's
think for the
diabetic?
most part, if the massage is done in a manner where you're kind of respecting kind of the muscles, the nerves, and different soft tissue structures in the area, it can certainly be very beneficial. It can help to improve the circulation that's going down to the feet. And it also can just help soothe the area. If you're adding certain pressure points, hitting certain nerves, that can actually provide really good relief for our patients
Hmm.
if someone really knows, some of those pressure areas to hit there. So definitely massage
Okay.
can be part of the armamentarium that's going to help our patients feel better.
Hmm. So I'm all about the stats. So it says that from the American Diabetes Association that nearly 50% of diabetics experience neuropathy, which reduces the sensation in their feet. And then there's another big word. It says cold-induced
Vasoconstriction,
vasoconstriction
yep.
can reduce blood flow in the feet by up to 20%
Mm-hmm.
in freezing temperatures. What is vasoconstriction?
Vasoconstriction. Yeah, that's just a fancy word. So when you're in really cold weather and the body senses that, it wants to make sure our brain, our hearts, our vital organs are warm. And so how it does that is it decreases the blood flow to our fingers and to our toes, to our extremities, to keep all the blood kind of inside our core. And the way it does it, it squeezes those blood vessels so that the blood doesn't go to the extremities and it stays to the core. So that's what vasoconstriction is. Vaso meaning vessel, constriction meaning, to close in. And so that's what that is. But, in essence, our feet and our hands get cold, but our feet and our hands get cold
Mhm.
versus some of our organs getting cold. So that's just our body's kind of response to making sure our core temperature stays what it needs to be. So a lot of times you'll see these movies and people are being the cold. And kind of a side note, I love like survivor movies, right? So I'm all about
Okay.
I think there's a movie coming out actually this week where it's about like a submarine. I'm still getting off track, but I
No, no, no.
yeah,
I think I
it's like
saw the
Woody
preview to
Harrelson,
that.
and so
Yes, I
I'm
saw
so
that.
about people having to survive. And that looks like a cool movie. They're gonna like they lose like contact with the submarine and they're down. One other
Mm.
movie, 47 Meters, where the guy's climbing in a cave. He's by himself, and and his arm gets trapped by a rock, and so he has to cut his arm off to get out.
Oh,
It
I
is.
think that was based on a
Short.
true story.
I'm like so about
Uh-huh.
those movies, like about like survival and
Yes.
stuff, and that's basically what happens with our body. And so you'll see people maybe they have a plane crash in a movie and they're stuck kind of on an icy mountain, and so to
Mhm.
survive, their body will send all that blood to their core. And so they may end up with like amputations of their fingers and their toes because their body's like, well, who cares about the fingers and toes? I need to keep your heart beating, right? People end up,
Yeah.
with gangrene
Mm.
and frostbite and all that kind of stuff because the body it acts as a survivor mechanism, so that we can keep our heart beating, we can keep our brain functioning. The body is an amazing, thing. Just the things that it does, and that's one of those things with that vasoconstriction.
Yes, Bezo. Yes, so I was just thinking about that, like as far as like the extreme version of that is
Mm-hmm.
frostbite and things of that sort. So it's our body just trying to protect the most
Exactly.
important organs versus spreading all of
Mm-hmm.
that, I guess, blood flow to the extremities that could eventually, like, of course, I mean, I love my fingers and toes, but I would rather
Yeah.
have my heart beating
Exactly.
and my mind, doing what
Yeah,
it
you can
wants
live
to
without your fingers
do.
and toes, So body knows that.
Yeah.
Hey, they want them, but I'm gonna keep your heart beating. So.
Yes. So what type of socks would you or what type of like I guess materials or socks would you recommend when going to sleep, or wearing what is a protective gear or equipment that you would think of that you would want to wear during these colder
Yeah, so
temperatures?
generally in the cold, I tell my patients it's okay if you want to wear like cotton or wool socks. You still have to be super, super careful that you're not having too much moisture build up in your feet, because even if it's cold outside and you keep your feet closed in socks and shoes, you can still build up that moisture. But at the same time, especially my folks with bad circulation or diabetes, sometimes that cotton and wool can actually, help insulate their feet and keep them warm. Now it's a different story like in the summer. I usually tell people don't wear cotton,
Mm-hmm.
don't wear wool, because that's going to trap all that moisture in there. You want to wear, something with kind of those mixed blend materials, uh, that's kind of,
Mm.
moisture wicking, and they actually take the moisture away from the skin. And that's the material that you normally want to use. But if it's super cold weather, you're talking about really trying to keep that heat in, or that, you're not getting too cold, especially in those particular populations.
What would you recommend for those that have like naturally sweaty feet?
So really thin socks. So again, I always tell my patients go to Dick's or go to REI, because they're
Mm.
going to have, you can ask the salesperson, say, hey, I sweat a lot. I need, a sock with material that's not going to hold the moisture. And they'll be able to point you in the right direction to those moisture wicking materials that you're going to be able to use. Because, if you start to get all that sweat in between your toes, all on your feet, then we're talking about, fungal infections and all that kind of stuff that we definitely don't want, to get into. And, for someone who doesn't have, anything that messes with their immune system, athlete's foot, is not something super, super serious. You definitely want to treat it. There are a lot of over the counter antifungal creams that you could use for it.
Okay.
But then when you're talking about folks who are a little bit older or who may have problems that mess with their immune systems, then athlete's foot can be serious. I mean, you can actually start to get really bad infections. And then once a fungal infection settles on your foot, then that can open up the door to bacterial infections. And when you get the bacterial infections, that when you really can be, in a lot of trouble. It can have those serious infections. So, my patients with any type of immunocompromise, so if they have rheumatoid arthritis, psoriasis, if they're on certain medications that's going to affect their immune system, if they just had cancer or going through chemo, diabetes, all these things, then I'm really treating those type of infections very seriously to make sure that they're not going to have anything else go on with their feet.
So you just said two different words that I thought meant the same thing. You said a bacterial infection, and then what was
Oh,
that
fungal.
other term? A fungal. So
Oh
those are
no,
not the same.
yeah, so a lot different. So they're caused by different, microorganisms. And so when you're talking about a fungus, basically you're talking about like a mushroom, right? So like the mushroom, like,
Yes.
kind of that we eat, uh, or mold or
Mm-hmm.
yeast is what you're talking about with fungus. And so you can't, if you have a fungus on your foot or anywhere in your body, you can't take an antibiotic, right? So antibiotics are specifically for bacterial, right? And so, yeah, so if you,
Okay.
that's why a lot of times you go to the doctor or go to the urgent care, you got the sniffles, your throat's sore. A lot of times they'll tell you, well, that's a viral infection. I can't give you any medicine for it. So, a lot of times we
Yeah.
want a Z-Pack. I do the same thing. I'll go to my doctor, I'm like, yo, my throat is killing me. Give me a Z-Pack. They're like, hey, you know better
Uh-huh.
than I do. There's like, you can't get an antibiotic. More than likely it's a
No.
viral
Mm.
infection. And so if you have a fungal infection, you have to have an antifungal for that. And so we don't have quite as many
Okay.
antifungals as we do antibiotics. And so sometimes when someone has a very bad, you know, fungal infection that goes through their body, we have very limited medications that we can give them. On the other hand, with bacteria, we have a little bit more antibiotics. But unfortunately,
Uh-huh.
we do see bacteria that are resistant to some of our antibiotics as well. So two very different things: fungus and then bacteria.
Two different things. Yes, spots, and so people don't understand the difference between the two. Going back to the dry skin, dried crack heals and skincare is definitely number one priority when it comes to winterizing yourself and your body. And all people always say when I'm like doing a pedicure for a guy in the winter, he all like it never fails. Like they always say, "Oh, I'm ashy because I took a shower." I'm like, that doesn't those two are not the same. And it's just like I feel like they think that I'm gonna, this is a safe space in the man cave, but I'm not gonna criticize you for being ashy. I mean, you should want to lotion your body from head to toe, and not because you think you're wearing pants and long sleeves that you shouldn't have to moisturize your skin. But I always tell people like moisturizing your skin, taking that time is a level of self-care because you're taking the time, you're sitting down, and I think it's a really good time for you to examine your body. If you're putting lotion on all your body or your shea butters, and you're taking the time, just take
Yep.
the time to go over every area of your body. You can see, oh, this is hurting, or this is tender, or I didn't see that bruise. And I feel like people take that opportunity for granted and not really lean into putting lotion. And that's a part of self-care, but it's also a way for you to be able to pay attention to your body, what's aching, and then taking the time to go from the head down to your soles and really get in between your toes, because a lot of things that are under your feet people don't see because they stop at the knee. They might even reach down to the ankle. Some people don't, but I think it's an opportunity to incorporate self-care every day and to examine your body. So dry, cracked skin, I would say, what if you don't have a product that has urea, what natural moisturizers would you
Yeah, I mean,
suggest?
you can even go old school with it. I mean, you can do Vaseline. If you can't get to the drugstore and get something with urea, Vaseline is great. The only caveat to Vaseline is that I do tell that
I'm like
I tell people,
baseline.
you got to be real careful with putting it in between your toes, because you put it in between your toes and you don't rub it in very well, that Vaseline just cakes up. And again, it makes it moist, and it could be a breeding ground for infections there. But I want to piggyback. I love that you said, putting, lotion can be a part of self care and can also be a part of looking at yourself and inspecting your skin. I mean, people don't, I don't think really realize it, but the skin is the largest organ of your body, right? And the skin is very important. It can have a lot of things go wrong with it. You could be, putting lotion on an area and say, hey, was that bump there all the time? Is that bump bigger?
Mhm.
Is that something I need to check out? And so I think that's a great thing to remember, is that in the morning, at night, you're putting on your lotion. It's just not something to do in vanity. You know, lotion
Yeah.
on real quick. It can be time that you
Right.
actually intentionally look for things that may be out of place with your body. And I always try to preach to my patients, you got to be intentional about stuff. That's kind of life, right? You can't just go floating through life, just being like, this is what I'm going to try to do. And maybe this happens today. You have to be intentional about various things. And caring for your body is one of those things. You gotta be wanting to make sure your health is okay. And, just taking that time in the morning, at night, I think that's a huge point that you brought up, is just be intentional about it. Make sure your skin is looking okay. Because I mean, we have a lot of skin cancers that are out there, and skin cancer can be terrible. Like you say, if it's on the bottom of your foot and you don't really
Right.
notice it, and then it starts to spread, it may be past the point where you can actually treat it. And so you want to make sure, if you have something on the bottom of your foot that wasn't there a month ago, 3 months ago,
Right.
check it out, or at least, make a mental note and say, I want to make sure I'm checking out this space every week. And if I notice a change, I'm going to call the doctor about it.
Absolutely. Yeah. And then I always tell guys, like, once you see the ash go away, then you go to the next side. That is an indicator that, you kind of iron that side of the body. And now you can go to the next. So some people, like, you get caught up and moisturizing the same part of your body. I'm like, no, once you see that the ash has gone from ashy to classy, then you go to the next area of your body. But yes, that's a perfect word about being intentional. And it's little things you can do throughout your day to incorporate self-care. It doesn't always have to be the major things like I'm going to get a manicure or a massage, but just sitting in a comfortable chair and putting on your favorite shea butters. We have a beautiful line of shea butters that are cologne scented, because that's another reason I was intentional about making our shea butter with the essential oils, because now we are introducing aromatherapy during that time. So if you're sitting down, you're putting the shea butter on your body, and now you're getting this fragrance. There's aromatherapy has so many benefits and things to it, as far as like mental clarity, reducing stress, clarity, and just self-care. So thank you for that word of being
Yeah.
intentional. But when it comes to dry and cracked heels, I wanted to talk about, and since we're talking about how to winterize your feet, how do boots play their part into like health and wellness of your
Yeah.
feet?
So are we talking about like casual boots, like fashionable boots, or are we talking about like work boots or?
I love the replay back. Would you say shoe for every occasion? So we can go into casual and then talk about the warehouse
Yeah,
work
so work
boots.
boots. So, with work boots, it can sometimes be hard to get kind of a good work boot for someone because it depends on their job, right? And so a lot of people
Right.
and women, depending on where they work, they may work, up at the airport here, they may work at Amazon or one of the other companies here in the area. They may need to wear steel toe or composite toe shoes. And that can be so rough on feet. So, they have to have protection in their forefoot at their toes to make sure, if something heavy falls on their foot, or, they're driving a forklift and something rolls over their foot, they have some level of protection. And so that's, why they're wearing steel toe shoes, or sometimes we call them composite because it be made of more material other than steel toe. And when
Okay.
someone has to wear a steel toe or composite shoe, you're looking at another game, another ball game here. And there's specific parameters that we have to, or I have to tell my patients to fall in so that they are going to be safe at their job. And so, there's countless times where people come in, they may have a foot problem or something. They're like, "Hey doc, can you write me a work excuse where I don't have to wear my steel toe?" I'm like, "No, I can't do that, because if I in the
Oh,
workplace without a steel toe and a forklift runs over your foot, yeah,
nappy.
blaming your boy, right?" And so while it may be more comfortable you walking around, it's going to be a lot less safe, if you don't have that steel composite toe. And so there are a few brands that I really like. There's Keens that work really well. They have really good arch support. They have a deep toe box. So when we're talking about a toe box, we're talking about the depth and the space that people have between their toes and the top of the shoe. And so Keens usually have a
Okay.
pretty deep toe box, and it works really well, and people can kind of spread their toes out so that they're not so cramped up in their shoes. And again, if they're not so cramped up, the toes aren't rubbing together, and so they're having a lot less blisters, a lot less, not
Mhm.
as much athlete's foot. And believe it or not, they can be at work more, they can be more productive. And so a lot of times,
Mm-hmm.
you don't even really realize that the type of work boot, the type of shoe that you're wearing, how it can make you even more productive. You have a work boot that's a half size too small, or the toe box is not wide enough. You're not going to want to work.
Sitting down.
You're going to be calling in,
No.
and then you call in sick enough times, you have enough strikes against you, you're out. And it all stemmed from a shoe that was too small. You know, it seemed like
Right.
it's such a small issue, but these types of things I see so much. And some people come into me and they think they have this big problem, and it actually is a problem, but it's something with a little bit simpler solution. And I tell them, again, I take out that insole, I tell them to put their foot on it, and I say, hey, you need like a half size shoe. And then I see them back, and they're like, that worked. It really changed. And it's like this little small change. They think I'm going to tell them, hey, you need some kind of surgery, or you need something crazy, or I got to make this expensive orthotic for you. And it's like, nah, you just need to get a bigger shoe size. That's it. So it's the small things, especially like with boots. Especially with boots usually have a little bit of a heel on them, whether it's a quarter inch or
Okay.
so. If people have problems in the front part of their foot, think bunions, hammer toes, nerve entrapments,
Mm-hmm.
corns, calluses. Those boots are going to actually put pressure on those areas to make them hurt more. So sometimes when we're thinking about a boot, we have to make a little bit more adjustments than we would even a normal shoe. So boots are a little bit
Okay.
challenging sometimes, even more casual boots. I tell women if a lot of women like to wear wedges, whether it's on a boot, whether it's on a sandal. And a lot of times wedges can be a
Mm-hmm.
little bit better than just a strict heel because there's a gradual
Yeah.
height to it, and not just, flat then going up to a 2-inch heel. And so even with their wedges and their heels on boots, we got to make sure that they don't have some type of deformities in the front part of their foot that boot or that heel is going to harm. So there's a lot of thought that goes into it. Even like, oh, this is just a boot. It's a lot of thought that, hey, maybe you shouldn't wear that boot right now, or maybe we need to fix something, or maybe we need to adjust something in your shoes so that you can wear that type of boot that you want to wear, or that you need to wear is something at your job.
Yes. And you said there's some other brands that you like. You mentioned King. Are there any other boot brands that guys that might hear this in the future could choose for when it comes to
Yeah, Red
work boots?
Wings are good as well. So, but a lot of
Mm-hmm.
times too, we have to kind of work in the parameters of particular jobs because some jobs will offer boots to their employees. Best thing though is that if
Okay.
sometimes they'll offer them like a per diem, so they'll give 150,
Yeah.
$200, for any boot. And then I usually recommend Kings. Secondly, I recommend Red Wings for them.
Great. Okay. Do you? I love Doc Martin, and Doc
Mhm.
Martens are steel toe. And there is like, I feel like there's a cloud in the soul because I feel like I could run a marathon in my Doc Martens. They are so comfortable, and I don't think a lot of people know that. And then another guy had told me that he wears cowboy boots because he says cowboy boots are super comfortable for him in a warehouse, and that surface that
Sure.
he's having to walk on. So I haven't heard anybody say that, but he swears by wearing cowboy
Yeah, I mean,
boots to work.
I cowboy boots and wearing them to work usually for how long people are on their feet, I usually don't recommend it. But depending on his foot type, you have a
Hmm.
foot type that the cowboy
Yeah.
fits just right. And I tell people if it's working for you and you're doing great and you're not really having any problems,
Right.
I ain't gonna change. Do what works for you. Everyone is
Yeah.
visual, and if that works for your foot type, go for it.
Absolutely. I'm a chat GBT girl. So when it comes to like waterproofing your feet, it says that, wet feet increase the risk of fungal infections and they have frostbite. So when it comes to these
Mhm.
waterproofing boots, like, are they really like, what is causing them to, what material or what is it that causes a boot to be
Well, it's
waterproof?
usually going to be like kind of a rubber material that kind of repels water most.
Okay.
And so, I mean, just think of like a rain boot kind of is usually going to be the main thing that folks are going to be wearing, whether they work in a wet environment or, they work outside a lot. And so again, the main thing with that is making sure that there's no moisture that builds up kind of in the sole of the boot. Usually it's going to have, no kind of material that soaks up moisture. Pretty much the whole thing is going to be some kind of polypropylene or rubber type material that's going to wick away that moisture from the foot.
Okay, cool. And let's see, one thing I had said. So when it comes to a proper boot, they say you want to take care, you want to make sure you have a proper arch support. You mentioned that. And the traction. And you always say you can tell a lot about a person's
Mm-hmm.
walking patterns based off
Where?
of their soles of their feet. So that is important as far as having a good grip. And then waterproofing. It says that to avoid getting fungal infections and frostbite. Cool. And once that was like slip and falls on ice during the winter. It usually is 1 million people are injured every year because they have
Mm-hmm.
slipped and fell on ice because they don't wear the
For
proper
sure.
shoe.
Yeah, I mean that's luckily here in the South we don't have a whole bunch of that. Other
We
than
don't have that.
last
Besides
week.
that snow
Yeah.
we had last
Yeah. I
week.
always tell people, take your time, try to, especially my older patients, try to wear slip resistant shoes. Like you were saying, if your shoes are wearing, it's just like a tire. If you wear your shoes so much and they're a year, 18 months old, they're not going to have that traction on the bottom. It's just like when you go and take your car to the shop and, your tire's losing tread. The same thing can happen with your shoes. So you want to make sure you're always checking kind of the soles of your shoes. And for the most part, if you're walking, 10,000 steps a day, you're looking at really changing your shoes, every 6 months or so in general. So, the slip and fall is real, and you just got to make sure you're taking your time, and the surface that you're walking on. If you work somewhere that has water on the floor, you got to make sure you have a slip resistant. And usually, most employers are good with that. They're going to make sure their employees have a slip resistant shoe to try to cut down on those accidents.
Yes. Piggybacking on what you were talking about, when it comes to athlete's feet, like does what is athlete's feet, first of all, and how do you
Yeah.
know that you have
So
it?
athlete's feet basically have the name because people start seeing kind of a rash and redness and itching in athletes, right? So I see them in
Okay.
athletes generally because they were walking around locker rooms, they had sweaty feet, and they're walking barefoot, and they would pick up these infections in their foot. And so the real term for athlete's feet, I'm gonna throw some out here to you, tinea. So that's kind of the Latin word for athlete's foot, and so
You said
tinea
what again?
pedis. Yeah,
Tinea
tinea pedis.
pedis. Latin. I know pedi is petty is
Yeah,
Latin. Okay, so
yeah, tinea
foot.
fungus in the foot, basically. And so, usually when people have tinea pedis, the number one thing they complain about is itching. So, it's like, and
Okay.
my feet are always itching. Usually, they're a little red as well. Usually, the redness and the itching is on the bottom of the foot, but it can also be in between the toes. And so, you usually kind of have people, have that macerated skin. So, kind of when you've been in the bathtub too long, it's all wet looking. And so, that's kind of what in between their toes can look like. Start to get that toe
Yeah.
jam up in there.
Yeah.
Yeah.
I see it all the time.
Yeah.
And it's deep in between the toes. Like if you're not looking like I'm actually looking and spreading toes, I see it all the time. And I don't think a lot of people know that they have athlete's foot because they don't take the time to really examine their feet like I do. So what would you like, what are some recommendations to some home care, or when is it time that you need to go see a
Yeah, so for the first
podiatrist?
part, if you notice that you have some redness on your foot, is itching somewhat, more than likely you do have athlete's foot. And so the first thing I tell folks is that, I would wash all of my socks. I would, if your shoes are really old, go ahead and get rid of the shoes. It's time to go shoe shopping.
Okay.
That's your excuse to get right?
Yes.
So you want to make sure what you're sticking your feet into are clean. Usually, the biggest thing with athletes' feet, it's somewhat of a hygiene issue, and it's not that people are just. It's just you're in a hurry. You got these shoes that you just, got wet outside. You sit them in your mud room and then you just put your feet back in them. And so not people are just dirty. It's just they're sometimes not thinking about, or you've been working out at the
Mhm.
Y or your gym and then you're walking barefoot. Or you're at a hotel and you're walking barefoot. And, a lot of times you don't think about that. You get into the shower barefoot and you don't know if kind of the maid's really clean like they needed to. Somebody before you could have had athlete's feet. And so, you could pick it up from them. So it is contagious. So if someone in your household have athlete's feet, you can get it from them. And so it's just really being aware about your surroundings and just kind of protecting yourself. But if you notice that you have athlete's foot, a lot of it you can treat on your own. I was saying
Mhm.
spray your shoes and socks with some kind of antifungal spray. And you should do that at least 2 or 3 times a week. And then they make antifungal creams as well. You can pick that up right from CVS or Walgreens. It's on the foot care aisle. Usually it's Lotrimin. So everyone's seen the commercial, like. And so
Yes.
usually if it's a minor or mild case of athlete's foot, usually that will work just fine. Generally, you follow the package instructions, you use it for about 2 or 3 weeks, then you're all good to go. But again, the important thing is making sure you got the hygiene because you can treat it, get it better, and then stick your feet back in those, nasty socks and shoes, and you're going to reinfect yourself. And so,
Yes.
the big thing is just being diligent about your hygiene. Now, let's say you use the Lotrimin AF, you've been using it for, 2 or 3 weeks, still got itching and everything going on. That's the time that you want to go and see the podiatrist, see a doc, because sometimes you need either a stronger cream, a prescription strength cream, or you may even need a pill sometimes to kill the fungus. And so that's when, if you just can't get rid of it, it's been going on for a month, or you get rid of it, it comes back, you get rid of it, it comes back. You're in this kind of cycle, then you need professional. You need to make sure you're all good with everything.
Yes, my phone looks like it wants to die on me. I was not paying attention to
It's a
that.
charger.
Yes, like go to the charger before it goes away. Hold on. This is why, boys and girls. There we go. Oh, that was pretty much. I left my notebook in the room, but I thank you so much again for always getting on the chat with me and talking to me about these various topics. One last thing, when it comes to taking care of your feet in the winter, is there well, you always mentioned shoes. What other things would we oh no, the thing I wanted to say was when you have athlete's foot, I always one of my mentors was telling me you don't want to use the towel. You want to change your towel out. You don't want to clean between. You want to dry between your toes. That's most important. But you don't want to take the towel that you clean your feet with to put back on your body because, like you said, it can be contagious and
Yeah,
it can
yeah, for
spread.
sure. So, again, being diligent and, what I would do is probably dry off, head and then go down, have your feet be the last thing that you dry off with and not kind of go back the other way. And so, the biggest thing is just, in the winter for sure, especially if you have certain conditions, diabetes, autoimmune problems, circulatory or bad circulation, you just want to be extra vigilant. The winter can be harsh. And, if you're going to go outside, even to the mailbox, don't go out in your Adidas slides. Put some socks on, put shoes on, and go out there because even a little bit of time out there, if you have problems, can present, injury to your foot. And then you're talking about, ending up, in the doctor's office or ended up in the hospital for something that is totally preventable. So again, making sure that you're preventing all these things, just being smart, covering up your feet when you need to, and then you'll be all good to go.
Indeed. One last thing. What do you think about grounding? Like, that's a spiritual principle that I hear all the time, taking off your socks and shoes and walking on the ground because it kind of helps. There's an energy in that and it can go up through your feet. Do you believe that is a thing or is there some science behind
I'm not
that?
sure there's real any like science or clinical data or studies that show that, but I think is a practice. If it helps someone spiritually, it helps them, get through certain things, or it helps them feel closer, to, their spiritual, well-being. I say, go for it. You bring that up. I'm a big football fan, and I think one of the NFL players, I think he played for Buffalo. I can't remember, but no matter what the weather was, it was a cold weather team. No matter what the weather was, he always showed up to the stadium barefoot, and he also had crazy outfits on. But he did that because he said, "Hey, it kind of puts me in my headspace. It makes me feel one with everything." And that's what he did. And he showed out on the field too. He was a great player. His team was doing great, and it's like, yeah, keep walking barefoot. It's working. So I'm no one to say, oh no, that doesn't work, or you should not be doing that. I think you should take proper precautions. If you are going to do that, right afterwards, make sure you're wiping your feet off, you're cleaning them. Even if you have some Lysol wipes or something, making sure that you're doing that. Really try to look to where you're standing, or barefoot. Make sure there's not foreign bodies, there's not glass, there's not splinters around, because that's a whole another realm, getting a foreign body, into your foot. But I probably wouldn't recommend, again, doing that if you have some kind of immune problem, because the infection risk is so high. But if you're pretty healthy, that's something you want to practice. Like everything else in life, just do it smart and be diligent about
Indeed. Well, on that note, Dr. Lanier, we have wrapped up another segment of
it.
10 Toes Down. Any any other last minute points that you think we should share with the people when it comes to making sure your feet are properly cared for
I
in
don't
the
think so. I think
winter?
we went through everything. We talked about good shoes. We talked about reasons, poor circulation and things of that nature that can really, the winter can really exacerbate. I think people, hopefully, kind of got something from this, and what they can do in the winter months to protect their feet.
Absolutely. Well, as always, thank you so much for your time, and
Sounds
we'll
good,
see you next
guys.
week.
You have a great night.
You too. Bye. Bye.